Have you ever found yourself in a situation where your patient refused the treatment recommended? This ethical dilemma is common in clinical practice. A competent adult has a right to consent or reject treatment. The reason for treatment refusal does not have to be sound or rational. In fact, a patient does not have to give any reasons at all. The doctor is bound to respect the refusal to treatment of a competent adult. Exceptions to the ethical principle of respect for autonomy do exist under the Mental Health Act 1983. Patients with psychiatric disorders may be lawfully detained in hospital against their wishes for treatment. Hi everyone, this is Dr. Erwin Kwun. My mission is to help doctors lead a happy and fulfilling life. I publish new video every Thursday on the subject of happiness and success. If you've not already subscribed to this channel, don't forget to subscribe and ring the bell so you're notified first each time I release a new video. In this video, we will cover what should the doctor do if patient refuses treatment. First thing first, I'd like you to pause this video and write in the comment section, how do you approach a patient who refuses treatment? I aim to read and respond to every comment. Please write down how you would approach this scenario before watching the rest of this video. It is crucial to consider 3 key points. The first point being capacity. Capacity is the ability to make a decision or take an action that impacts on a person's life. The capacity of a patient to make decisions about their own care and treatment is fundamental to the ethical principle of respect for autonomy. Capacity should be assumed unless proved otherwise. If a patient declines treatment, it's important to assess the person's capacity. The Mental Capacity Act states that someone is unable to make a decision if they cannot meet one or more of the 4 criteria. The first criteria being understand the information relevant to the decision. This includes reasonably foreseeable consequences of whatever decision is made or of failing to make a decision. The second criteria is retain that information in making the decision. The third criteria is use or weigh the information available. The last criteria being to communicate the decision by any means, including speech, sign language, or simple muscle movement. A person failing one or more aspects of this task is deemed to lack the relevant capacity, but you must try to find ways of communicating with a patient before determining they lack capacity. In other words, you must first assume capacity and support patients to make their own decisions before deciding they do not have capacity. Capacity is a key component of informed consent to medical treatment. A competent adult is entitled to decline treatment even if the doctor disagrees with their decision or believes it to be unwise. The second point is informed decision. The doctor has a duty to give appropriate information about what treatment involves. The benefits and risks of treatment must be explained. Consequences of not going ahead with treatment must also be discussed. The doctor must discuss reasonable alternative treatments. In other words, the patient needs to be sufficiently informed to be able to make a choice. Let me give you a working example. Mr. Smith, age 67, suffers with crushing chest pain. You're worried he might have an acute coronary syndrome and recommends admission to hospital for further assessment and treatment. The patient doesn't want to go to hospital. In this scenario, it is important to ensure that Mr. Smith is given sufficient information to make an informed choice about admission. The doctor must explain the consequences of not going to hospital and delay in receiving treatment. A major complication of acute coronary syndrome is death. This information needs to be conveyed sensitively to the patient. This could be phrased as following: Mr. Smith, we're dealing with a potentially life-threatening condition. I would highly recommend we admit you to hospital for further assessment and treatment. Now the patient is aware of death as a consequence, he might choose to accept the idea of admission. If the patient has capacity and still makes an informed choice to refuse a recommended treatment, the doctor might want to explore the reason behind refusal. Treatment refusal could be due to misinformation, fear, personal values, and belief. This might reveal a solution or a different approach. Sometimes involving family members in the conversation might help to get everyone on the same page. The third point is voluntary decision. Decision to consent or decline treatment must be made voluntarily without undue pressure by healthcare professionals, friends, or family. In other words, If a decision is made under coercion, it is not valid. It is worth highlighting the difference between persuasion and coercion. Persuasion is the act of changing a person's attitude or behavior by reasoning. Coercion is a use of fear or threat to compel a person to make a decision involuntarily. Persuasion can be used as long as a patient is not being coerced to make a decision. It is worth knowing about advanced decision. A competent adult can make a decision to refuse particular medical treatments for a time in the future when he may not be able to make such a decision. This is known as a living will. This includes refusal to treatment that could potentially save the person's life, such as ventilation and cardiopulmonary resuscitation, CPR. Advanced decision needs to be discussed with a healthcare professional. Patient can change their mind and review their decision. If a patient refuses treatment and then decides that they want to go for treatment, they need to be aware that they can do so. It is essential to consider the 3 points we have covered when dealing with treatment refusal: capacity, informed decision, and voluntary decision. If you want more videos like this, smash the like button. If you have not already subscribed, don't forget to subscribe to this channel and ring the bell to be notified first each time I publish more videos. Thank you so much for watching. Take care everybody. See you in the next video.